Okay, hi everyone. Thank you so much for joining this breakout room, which will be focusing on abstracts related to COVID-19. As a friendly reminder, each group will present for 5 minutes and we'll have about a 10-second grace period for folks who need to share their screen or get their slides ready. And so once everyone presents for 5 minutes, we'll have some Q&A at the end of that time, and we will do this 3 times. So we will be rotating. So first, I guess I would like for our abstract presenters to maybe introduce themselves, starting with Amanda and Noor.
Hi, my name is Noor Hasan. I am a research specialist with the Sinai Urban Health Institute.
Hi, everyone. I'm Amanda Peters. I'm also a colleague of Noor Hasan with the Sinai Urban Health Institute.
Thank you both. And our next set of presenters are Megan and Vanessa.
Hi, I'm Megan B. I'm an undergrad student at UIC. And hello, my name is Vanessa Marquina. I'm also an undergraduate student at UIC.
Thank you. And our last set of presenters, Catalina and Kasmrinh. My apologies.
Good morning. I am Kathy Ortiz. I am faculty at Triton College, but I currently work in partnership with DrPH, supervising contact tracers for the last 2 years. So hello, everybody.
My name is Kasmrinh, but you can call me Kaz. I also work with CDPH, and I'm also a student at DePaul University.
Great. Well, thanks, everyone. So we'll just jump right into it. And Amanda and Noor, you can start your abstract presentation now. I believe you can share your screen, but if you have any issues, either let myself or Neha know.
All right, thank you so much. I'm gonna start sharing my screen. Can you see everything okay?
Yep, we see the slides.
All right, hi everyone. My name is Noor Hasan. As I said, I'm a research specialist with the Sinai Urban Health Institute, or SUHI, and I'm joined today by my colleague Amanda. We are presenting on the community engaged approaches to understanding COVID-19 vaccine hesitancy in African American and Latinx communities in Chicago. So just for a little bit of context, the Sinai Urban Health Institute, or SUHI, is the community engaged research arm of the Sinai Chicago Health Hospital System. So we've been engaging African American and Latinx community members in several research and evaluation efforts, all aimed at understanding COVID-19 vaccine hesitancy. And we're going to discuss the process that we use to engage community members in research, as well as highlight some of the lessons learned and preliminary results from that research. So for a little bit of background and reasoning behind our focus on COVID-19, although we all know that vaccines have had a tremendous impact on curbing the pandemic, there have been substantial barriers in vaccination uptake all across the country, especially in Chicago and especially in Black and Latinx communities. So in the Chicagoland area, we're seeing disproportionate rates of COVID-19 infection and death, as well as lower rates of vaccine uptake. And although that gap is closing for some groups, there is still a very large gap in vaccination, especially between Black and non-Black Chicagoans. So as you can see on this graph right here, from left to right, green represents Asian non-Latinx Chicagoans, purple represents Black non-Latinx Chicagoans, blue represents Latinx Chicagoans, and red represents white non-Latinx Chicagoans. And this is a percentage of people who have completed their vaccine series as of the end of March.
Noor, can I pause you for a sec? I'm getting comments in the chat about folks not being able to hear your audio. Maybe it's a little muffled.
Is this better?
Yeah, I think that's better.
Okay.
Thank you.
So basically, this is just the percentage of people from different racial and ethnic groups who have completed their vaccine series in Chicago. And as you can see, there's still a wide gap that persists.
So much of our work has been done with the Health First Collaborative, or HFC. So HFC is a philanthropic collaborative led by the Michael Reese Health Trust that invests in solutions to address racial inequities throughout the Chicagoland area. So in Chicagoland, we've been leveraging community voice with the HFC by convening a 20-member Community Advisory Council, or CAC, that's organized into 3 work groups. So community mobilization, workforce development, and data and evaluation. CAC members are paid and provided with resources that facilitate their equitable participation in our projects. And this map here shows where all of our CAC members are from throughout the Chicagoland area and the suburbs. So there are 2 primary methods of engagement that we're going to be talking about. So the first is the COVID-19 vaccination pulse survey. So this is the pulse survey that was given throughout the Chicagoland area to both vaccinated and unvaccinated individuals, asking their thoughts around the vaccine, the pandemic, etc. And then it was funded by the Rockefeller Foundation and designed by Mathematica as a part of the Equity First Vaccine Initiative, as well as a vaccine incentive pilot survey that the CAC helped us design and was a guiding force in kind of informing. And this was a program that incentivized people to get their first dose of vaccine in exchange for a $100 Visa gift card that was accompanied by a short survey that we used as an evaluation tool. So after the end, from July basically to September, we brought back some of the results from that vaccination pulse survey to our CAC members, and we asked them, what are some gaps in understanding from these preliminary survey results? What else would you want to know about these survey results? What do you want to understand more? What's missing? And how can we disseminate this data back to the community in a way that makes sense to you, in a way that's really palatable? And so from that, the CAC basically guided the formation of focus groups that ask about trusted sources of information related to COVID-19, barriers and motivators to getting vaccinated, and people's experiences surrounding the vaccine. This resulted in 4 focus groups, 2 English speaking and 2 Spanish speaking, with 15 total participants from the Chicagoland area, 93% of which were Black or Latinx, all of which were between 20 and 66, 2/3 of which had been recently vaccinated, and 1/3 of which had been unvaccinated, which kind of matches the Chicago numbers that we're seeing. And currently an analysis is taking place of those results. All focus group members were compensated for their time with a $50 gift card, and the CACs were essential in kind of leading to the formation of this focus group. And some of our conclusions from all these activities that we've been engaging in. So from the surveys, we know that for vaccinated people, their predominant motivator for getting vaccinated is simply to prevent illness, while for unvaccinated people, their predominant concern has to do with just vaccine safety and vaccine side effects. But those focus groups were really key in kind of giving us more insight onto those preliminary survey results, especially around trusted messengers. So we knew that healthcare providers were trusted messengers and family and friends were trusted messengers, but we saw that family and friends who work in healthcare were really key in getting unvaccinated people to actually get the vaccine. So this is just a quote from someone in reference to their own healthcare provider. "I trust the credentials and them being related and the friendship and the relationship that has been built. They were open to talking about it and there was no fear in talking to them." So having a trusted family member who is in healthcare was really essential in getting people vaccinated. Any questions?
That was awesome. Thank you so much. For the sake of time, we will move on to our next presentation, which will be on COVID-19 Youth Ambassador Program, the UI Health Champions Experience.
All right, thank you, Diana. So my name is Vanessa and I'm here with Megan, and we're going to focus on a COVID-19 Youth Ambassador Program, the UI Health Champions Experience. To give you all some background, Champions is a 6-week summer internship program for Chicagoland high school students, and we focus on exposing them to different health career pathways, motivate them to pursue a post-secondary education, and empower them to become youth advocates. Last summer, in collaboration with the Chicagoland Vaccine Partnership at One Side United, we helped in the development of the COVID-19 Youth Ambassador Program, which is a multi-stage program. And we focused on ensuring that our students had the knowledge, the tools, and we empower them to be able to talk to their peers, their family members, their community members about COVID-19. And in the following slide, we'll go more in depth into our different modules that we covered within our COVID-19 Youth Ambassador Program. So here's a little bit about our Summer 2021 Champions program. It was in a virtual format with 37 high school participants and included various guest speakers from the IC School of Public Health faculty to hospital medical residents. And the way that our modules were formatted were that we had 3 modules that covered the basic introductory information that we expected students to need to use for the latter modules. So this included introductory information about public health and advocacy, viruses in the immune system, and about COVID-19 itself. And then our 3 next modules went a little bit more in detail and nuance about specific issues or concerns that we thought students might have about COVID-19 and vaccines, such as vaccine development and facts, health disparities and health equity within their own communities, and addressing health misinformation. And then our 7th module wasn't actually a lecture or a session, but rather a project that we assigned students for them to use information that they thought was pertinent that they learned from the modules, or they thought that their community should know about COVID-19 or any of the information that they had received from those modules. We evaluated our students in our program through 2 methods. One was a program pre and post assessment done in the beginning and end of our program, and another were module specific pre and post quizzes done after each of the 6 modules that had an actual lecture session. Like I mentioned, our 7th module wasn't actually a session, but rather a project, and it was our health advocacy project. And this was a creative way for our students to show what they learned in our program. And we asked them to make a TikTok or Instagram reel, a photo, an art piece, or an infographic that we thought would make an impact on showing us what they learned. Next, we'll talk a little bit more about what we learned specifically from our modules. And like I mentioned before, it was 6 sessions and in total about 22 total hours of training. And we found that 77.8% of students really agreed with the statement that, yeah, modules facilitated my understanding of serving as a youth COVID-19 health ambassador in my own community. And at the time, 80.8% of them were willing to get the COVID-19 vaccine. At the time, they were not eligible to, but once they were eligible to, they thought that they had enough information to make the decision to go forward with receiving the vaccine. We found a lot of them received information that they found pertinent to share within their own community or social circle and felt empowered to do so. And they found that the information, while sometimes repetitive, helped them really push forward that agenda. And then like I mentioned, our 7th module was the health advocacy project. And on the right, you can actually see 3 examples of infographics that our students created this summer. And more creative projects such as TikTok Reels and Instagram Reels, which we can't show here, can be found through the QR code at the bottom right. And for our lessons learned and next steps, we will be having our summer internship this upcoming summer, and we'll be reviewing our modules and modifying them based off of students' feedback. We want to ensure that within our modules, we have engaging activities that our students like to enjoy. We also want to be able to connect our students with community-based organizations or initiatives such as Greater Than COVID or Illinois Unidos, among a few of them mentioned below. And in the past, we have collaborated with Combat COVID, which is a partnership that we want to continue on into the future. Overall, our COVID-19 Youth Ambassador Program has served as a collaborative effort to encourage our students to become our next future health professionals, as well as our community health advocates. Thank you so much for listening to our presentation.
Thank you both so much. In our final presentation, OVA East, Reflections on COVID, Conflict, and Collaboration on Chicago's Southeast Side.
Good morning. I'm trying to get my video back started. So good morning again. I am Kathy Ortiz, and Kasmrinh Faulkner is my co-presenter. And we were actually a team of 15 co-authors and co-contributors. And so we'll go ahead and just jump right into it. So in January of 2022, during the height of Omicron, 60617, which includes the communities that were researched, had a positivity rate of 27%, and we really wanted to see what happened. So we went back to community conversations that we had over the course of a year, and pulled on those people, invited them back just to really have a discussion regarding things that have happened, and then explored a little further their experiences during the pandemic. Um, so basically what we wanted to look at was those lived experiences um, for members of the Southeast community. And those communities specifically include South Chicago, South Deering, Headwish, the East Side, and Jeffrey Manor. And those communities are all part of the 10th Ward. And so what we found was that, there were already existing structural inequities that our communities were facing, but we found that there was a lot of youth-led organization that happened in ways that we just didn't see happen previous to the pandemic. And those things really centered around the murder of George Floyd in May of 2020, contentious LSC decisions to remove, school resource officers over the summer of 2020, like those votes were taking place that entire summer. And we saw this community become divided over certain issues, but also how they came together and how that led to transformation. So this really examines those lived experiences. Next slide, Kat. Sorry.
So a critical race theory framework was employed to examine the experiences as described by members of the community to understand the impact of COVID-19. This approach provided insight into systemic inequities embedded in policy and practice and the ways it further marginalized members of the community. So 15 participants were selected and in-depth interviews were conducted to collect rich, detailed descriptions of the phenomena over the course of a year. Open-ended, semi-structured questions were created, and some of those include in what ways did work, family life, and school routines change? Can you share what it was like the first week of the shelter-in-place orders? What protective practices and protocols did you use to decrease the chances of catching COVID? Please share your feelings around support systems via government offices or other institutions. Can you recall specific initiatives by community-based organizations? And what kind of support was offered? Did you use any of these services?
So the data was organized, it was reviewed, it was reorganized, and then we found certain themes and repetitive statements that came out of those interviews. And so what we did was we broke them down into 5 different groups, and we have relabeled those. So one is measured worth, right? Measured worth describes the discontent with the resources compounded by the intersections of race, gender, age, and language. Number 2 is we are not the same, and that describes the discord with perceived failed public health policies and practices. The power of youth voice and collective action highlights the increased youth activism and collaborative efforts between and across organizations. 4th, all day, every day, right, speaks to the challenges of the shift in home life as we've all experienced, and what that meant for families. And 5, we have to do better. Illustrates the greater demand for equity in education and public health at all times and not just during a crisis. So some of the themes that we did find, some examples were, feelings of fear, being dismissed and overlooked, the challenge of single parenthood, the creation of mutual aid societies, overlooked because, people felt that their age, prevented them from having access to certain things, the lack of mobility, people who don't drive, transportation, how do they get to vaccine sites, testing sites, immigration status and language, loss of income, mistrust of government. And so we were able to organize into the 5 previous categories that I mentioned. So what we found was really this individual and collective, coming together of community relationships, identities between these organizations, and the challenges which had significant implications for members existing in the margins. Public health initiatives were largely invisible, according to our participants, or they were limited at the onset. And they felt that community organizations really kind of stepped up and helped them through that process. The loss of work, lack of access to food, really all help describe like what happened, including the organizing by the youth. They organized marches in the community, and that led to a lot of discussions, on social media in the different community groups. People learned about their neighbors, those values, those beliefs, and so there was a lot that happened in these discussions that really led to why it was necessary to capture this information and tell these stories. I think it's important to look at this information to pretty much like shape and shift, policy in terms of the investment that is needed for perhaps community-based organizations to really get in and do that work. And further, I want to add that Calumet Area Industrial Commission is the organization that we are hired by, and they strategically employed people from the 9th and 10th wards to do this work in the community to help mitigate COVID-19. Thank you. I think I beat the clock.
Thank you so much. Yeah, thank you, everyone. I think we might have, I don't even know if we have time for one question, but if folks do have questions, they can maybe stick around. We do have a 2-minute transition period, so feel free to ask questions during that time, or also feel free to switch to another breakout room. But I hope that everyone enjoys the rest of the conference, and presenters can just stick around, and we will continue on with the presentations shortly.